Hello, everybody. Welcome to Ophthalmology Mastery Clinical Skills for MBBS students. So, in this video, we learn about blindness. Okay, so it's a commonly asked question in Committee Opthal section. You can be asked questions on what is blindness, what is the types of blindness, what are the causes of blindness in Viva OC. So, you need to know blindness. So there are two definitions, the WHO definition and the NPCB definition. The WHO definition says best corrected visual acuity of 3 by 60 or worse in the better eye. All the words are important. You have to say all the whole definition. So it's best corrected visual acuity. So you've given the correction, and the best corrected visual acuity is 3 by 60 or worse in the better eye. Okay, so the other eye must obviously has a worse vision than this. NPCB on the other hand says presenting visual acuity of 3 by 60 or worse in the better eye. So here it is presenting visual acuity. So the patient might not be wearing glasses, and if you correct it, maybe you will have a better vision. But NPCB still takes presenting visual acuity of 3 by 60 or worse in the better eye as the definition of blindness. WHO also adds central visual field of less than 10 degrees is also called as blindness according to WHO definition. Right, now coming to the classification of blindness and visual impairment, there are two classifications. One, there's a category from 0 to 5, normal being 666 to 618. Below 618 to 3 by 60 it is called as visual impairment. Below 360 it is called as blind. So between 618 to 3 by 60 it is classified as visual impairment or severe visual impairment, and anything below 3 by 60 it is called as blind. Okay, and it is classified as blind 3 by 60 to 1 by 60 as third category, and then fourth 1 by 60 to PL. Now there's another classification which you all have to know. Vision impairment 618 to 660. Between 660 to 360 we call it as economic blindness, and between 3 by 60 to 1 by 60 we call it as social blindness. Here even the central visual field is less than 10 degrees. Between 1 by 60 to PL positive we call it as legal blindness or manifest blindness. Here the central visual field is less than 5 degrees, and PL negative is called as absolute blindness. Again, please remember it is in the better eye. Okay. Now the definition of vision impairment used in National Blindness and Vision Impairment Survey. Here they classify visual impairment into three categories: severe, moderate and mild. So 660 to 618, 612 they classify it like that, and below 3 by 60 is called as blindness. Now there's another definition: curable blindness or preventable blindness. Curable blindness is a stage where blindness is reversible by prompt management. Example, cataract. So when cataract has developed, patient has gone blind, but you can cure it. Whereas preventable blindness, loss of vision that could have been prevented by effective preventive and prophylactic measures, like you prevent, adopt safe strategy and prevent trachoma, or give a vitamin A prophylaxis. You can prevent xerophthalmia. These are preventable blindness. The term avoidable blindness includes both curable blindness and preventable blindness. Right? The last thing about blindness that you need to know is causes of blindness, which can vary in the world and India. They're similar, but also you see some changes in the world. Cataract, the topmost cause of blindness are cataract, glaucoma, diabetic retinopathy, trachoma, vitamin A deficiency, and onchocerciasis, otherwise called as river blindness, which is more common in South America. Whereas in India, uncorrected refractive errors, cataract, diabetic retinopathy, glaucoma, and age-related macular degeneration is the most common causes. Now, coming in conclusion, you need to know the definition of blindness and visual impairment. You need to know what is economic blindness, social blindness, and legal blindness, and curable blindness and preventable blindness, and avoidable blindness, and the causes of blindness. Thank you very much.